الشيطان الرجيم بسم الله الرحمن الرحيم استغفر الله الذي لا إله إلا هو الحي القيوم ذو الجلال والإكرام وأتوب إليه يا قياس المستقيسين يا حبيب قلوب الصادقين ويا إله العالمين أفتراك سبحانك يا إلهي وبحمدك تسمع فيها صوت عبد مسلم سجن فيها بمخالفتي وذاق طعم عذابها بمعصيتي وحبس بين أطباقها بجرمي وجريرتي وهو يزج إليك زجيج مؤمل لرحمتك ويناديك بلسان أهل توحيدك ويتوسل إليك بربوبيتك يا مولاي فكيف يبقى في العذاب وهو يرجو ما سلف من حلمك أم كيف تؤلم النار وهو يأمل فضلك ورحمتك أم كيف يورق ليبا وأنت تسمع صوتا وترى مكانا أم كيف يشتمل علي زفيرا وأنت تعلم زأفا أم كيف يتقلقل بين أسواقها وأنت تعلم صدقا أم كيف تزجر زبانيتها وهو يناديك يا رب أم كيف يرجو فضلك في إتقي منها وتتركه فيها حيات ما ذلك الظن بك ولا المعروف من فضلك ولا مشبه لما عملت بالموحدين بالبرك وإحسانك فباليقين أخطأوا لولا ما حكمت به من تعذيب جاهديك وقضيت به من إخلاد معانديك لجعلت النار كلها بردا وسلاما وما كان لأحد فيها مغرا ولا مقاما لكنك تقدست أسماؤك أقسمت أن تملأها من الكافرين من الجنة والناس أجمعين وأن تخلد فيها المعاندين وأن تجل ثناؤك قلت مبتدئا وتتولت بالإنعام متكرما أفمن كان مؤمنا كان كمن كان فاسقا لا يستوون إلهي وسيدي فأسألك بالقدرة التي قدرتها وبالقضية التي حتمت وحكمت وقلبت من علي أجريت أن تاب لي في هذه الليلة وفي هذه الساعة كل جرم أجرمت وكل ظلم أذنبت وكل غبي أسررت وكل جهل عملت كتمت وولنت أخفيت ووزرت وكل سيئة أمرت بإثباتها الكرام الكاتبين الذين وكلتهم بحفظ ما يكون مني وجعلتهم شهودا علي مع جوارحي وكنت أنت الرقيب علي من ورائهم والشاهد لما خفي عنهم وبرحمتك أخفيت وبفضلك سترت وأن توفر عظيم من كل خير أنزلت أو إحسان فضلت أو بر نشرت أو رزق بفاته أو ذنب تغفر أو خطأ تستر يا ربي يا ربي يا رب يا ربي يا ربي يا رب يا إلهي وسيدي ومولاي ومالك رقي آمن بيدي ناصيتي يا عليما بضري ومسكنتي يا خبيرا بفقري وفاقتي يا ربي يا ربي يا رب يا ربي يا ربي يا رب أسألك بحقك وقدسك وعظم صفاتك وأسمائك أن تجعل قوتي أوقاتي من الليل والنهار بذكرك معمولا وبخدمتك موصولا وأعمالي عندك مقبولا حتى تكون أعمالي وأورادي كلها بردا واحدا وحالي في خدمتك سرمدا يا سيدي يا من علي مولي يا من إلي شكوت أحوالي يا ربي يا ربي يا رب يا ربي يا رب قف على خدمتك جواري واشدد على لزيمة جوانه وهب لي الجد في غشيتك والدوام في الاتصال بخدمتك حتى أسرح إليك في ميادين السابقين وأسرع إليك في البارزين واشتاق إلى قربك في المشتاقين وأدنو منك دنوب المخلصين وأخافك مخافة الموقنين واجتمع في جوارك مع المؤمنين اللهم من أرادني بسوء فرد ومن كادني فكد واجعل لي من أحسن عبيدك نصيبا عندك واقرب منزلة منك وخصم زلفة لديك فإنه لا ينال ذلك إلا بفضلك وجد لي بجودك واتف علي بمجدك واحفظني برحمتك واجعل لساني بذكرك ليجا وقلبي بحبك متيم ومن علي بحسن إجابتك واقني أفرتي واغفر زلتي فإنك قضيت على عبادك بعبادتك وأمرتهم بدعائك وزمنت لهم الإجابة فإليك يا ربي نسبت وجهي وإليك يا ربي مددت يدي وبعزتك استجب لي دعائي وبلغني مناي ولا تقطع من فضلك رجائي واكفني شر الجن والإنس من أعدائي يا سريع الرضا اغفر لمن لا يملك إلا الدعاء فإنك فعال لما تشاء يا من اسمه دواء وذكره شفاء وطاعته غناء ارحم من رأس مال الرجاء وسلاه البكاء يا سابق النعم يا دافع النقام يا نورا مستوحشين في الظلام يا عالما لا يعلم صل على محمد وآل محمد وافعل بما تهلو صلى الله على رسولي والأئمة الميامين من آلي وسلم تسليما كثيرا برحمتك يا أرحم راحمین. فو شفای مریض، سلامتی آقایان زمان، آل مرحومین، رحم الله من غرفات هم صلوات.
Assalamu alaikum everyone. As today it's a special program, we'll have Surat Yasin right now, then Ziyarat Warisa, and inshallah, just before the interact session, we'll install the partition as well. So the ladies will be on my left, and then the gents on my right, inshallah. Thank you.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ياسين والقرآن الحكيم إنك لمن المرسلين على صراط مستقيم تنزيل العزيز الرحيم. لتنذر قوما ما أنذر آباؤهم فهم غافلون. لقد حق القول على أكثرهم فهم لا يؤمنون. إنا جعلنا في أعناقهم أغلالا فهي إلى الأذقان فهم مقمحون. وجعلنا من بين أيديهم سدا ومن خلفهم سدا فأغشيناهم فهم لا يبصرون. وسواء عليهم أأنذرتهم أم لم تنذرهم لا يؤمنون. إنما تنذر من اتبع الذكر وخشي الرحمن بالغيب فبشره بمغفرة وأجر كريم. إنا نحن نحيي الموتى ونكتب ما قدموا وآثارهم وكل شيء أحصيناه في إمام مبين. واضرب لهم مثلا أصحاب القرية إذ جاءها المرسلون إذ أرسلنا إليهم اثنين فكذبوهما فعززنا بثالث فقالوا إنا إليكم مرسلون. قالوا ما أنتم إلا بشر مثلنا وما أنزل الرحمن من شيء إن أنتم إلا تكذبون. قالوا ربنا يعلم إنا إليكم لمرسلون وما علينا إلا البلاغ المبين. قالوا إنا تطيرنا بكم لئن لم تنتهوا لنرجمنكم وليمسنكم منا عذاب أليم. قالوا طائركم معكم أئن ذكرتم بل أنتم قوم مسرفون. وجاء من أقصى المدينة رجل يسعى قال يا قوم اتبعوا المرسلين اتبعوا من لا يسألكم أجرا وهم مهتدون وما لي لا أعبد الذي فطرني وإليه ترجعون أأتخذ من دونه آلهة إن يردني الرحمن بالضر لا تغن عني شفاعتهم شيئا ولا ينقذون إني إذا لفي ضلال مبين إني آمنت بربكم فاسمعون قيل ادخل الجنة قال يا ليت قومي يعلمون بما غفر لي ربي وجعلني من المكرمين وما أنزلنا على قومه من بعده من جند من السماء وما كنا منزلين إن كانت إلا صيحة واحدة فإذا هم خامدون يا حسرة على العباد ما يأتيهم من رسول إلا كانوا به يستهزئون ألم يروا كما أهلكنا قبلهم من القرون أنهم إليهم لا يرجعون وإن كل لما جميع لدينا محضرون وآية لهم الأرض الميتة أحييناها وأخرجنا منها حبا فمنه يأكلون وجعلنا فيها جنات من نخيل وأعناب وفجرنا فيها من العيون ليأكلوا من ثمره وما عملت أيديهم أفلا يشكرون سبحان الذي خلق الأزواج كلها مما تنبت الأرض ومن أنفسهم ومما لا يعلمون وآية لهم الليل نسلخ منه النهار فإذا هم مظلمون والشمس تجري لمستقر لها ذلك تقدير العزيز العليم والقمر قدرناه منازل حتى عاد كالعرجون القديم لا الشمس ينبغي لها أن تدرك القمر ولا الليل سابق النهار وكل في فلك يسبحون وآية لهم أنا حملنا ذريتهم في الفلك المشحون وخلقنا لهم من مثله ما يركبون وإن نشأ نغرقهم فلا صريخ لهم ولا هم ينقذون إلا رحمة منا ومتاعا إلى حين وإذا قيل لهم اتقوا ما بين أيديكم وما خلفكم لعلكم ترحمون وما تأتيهم من آية من آيات ربهم إلا كانوا عنها معرضين وإذا قيل لهم أنفقوا مما رزقكم الله قال الذين كفروا للذين آمنوا أنطعم من لو يشاء الله أطعمه إن أنتم إلا في ضلال مبين ويقولون متى هذا الوعد إن كنتم صادقين ما ينظرون إلا صيحة واحدة تأخذهم وهم يخصمون فلا يستطيعون توصية ولا إلى أهلهم يرجعون ونفخ في الصور فإذا هم من الأجداث إلى ربهم ينسلون قالوا يا ويلنا من بعثنا من مرقدنا هذا ما وعد الرحمن وصدق المرسلون إن كانت إلا صيحة واحدة فإذا هم جميع لدينا محضرون فاليوم لا تظلم نفس شيئا ولا تجزون إلا ما كنتم تعملون إن أصحاب الجنة اليوم في شغل فاكهون هم وأزواجهم في ظلال على الأرائك متكئون لهم فيها فاكهة ولهم ما يدعون سلام قولا من رب رحيم وامتازوا اليوم أيها المجرمين ألم أعهد إليكم يا بني آدم أن لا تعبدوا الشيطان إنه لكم عدو مبين وأن اعبدوني هذا صراط مستقيم ولقد أضل منكم جبلا كثيرا أفلم تكونوا تعقلون هذه جهنم التي كنتم توعدون اصلوها اليوم بما كنتم تكفرون اليوم نختم على أفواههم وتكلمنا أيديهم وتشهد أرجلهم بما كانوا يكسبون ولو نشاء لطمسنا على أعينهم فاستبقوا الصراط فأنى يبصرون ولو نشاء لمسخناهم على مكانتهم فما استطاعوا مضيا ولا يرجعون ومن نعمره ننكسه في الخلق أفلا يعقلون وما علمناه الشعر وما ينبغي له إن هو إلا ذكر وقرآن مبين لينذر من كان حيا ويحق القول على الكافرين أولم يروا أنا خلقنا لهم مما عملت أيدينا أنعاما فهم لها مالكون وذللناها لهم فمنها ركوبهم ومنها يأكلون ولهم فيها منافع ومشارب أفلا يشكرون واتخذوا من دون الله آلهة لعلهم ينصرون لا يستطيعون نصرهم وهم لهم جند محضرون فلا يحزنك قولهم إنا نعلم ما يسرون وما يعلنون أولم يرى الإنسان أنا خلقناه من نطفة فإذا هو خصيم مبين وضرب لنا مثلا ونسي خلقه قال من يحيي العظام وهي رميم قل يحييها الذي أنشأها أول مرة وهو بكل خلق عليم الذي جعل لكم من الشجر الأخضر نارا فإذا أنتم منه توقدون أوليس الذي خلق السماوات والأرض بقادر على أن يخلق مثلهم بلى وهو الخلاق العليم إنما أمره إذا أراد شيئا أن يقول له كن فيكون فسبحان الذي بيده ملكوت كل شيء وإليه ترجعون صلوات
Brothers and sisters, if I can ask you to please rise for Ziyarat al-Warsa, and after Ziyarat al-Warsa the partition will be installed so the ladies can join us inshallah. Salawat.
بسم الله الرحمن الرحيم اللهم صل على محمد وآل محمد السلام عليك يا رسول الله السلام عليك يا نبي الله السلام عليك يا أمير المؤمنين يا علي بن أبي طالب السلام عليك يا فاطمة الزهراء سيدة نساء العالمين السلام على أبي محمد الحسن بن علي المجتبى ورحمة الله وبركاته السلام عليك يا وارث آدم صفوة الله السلام عليك يا وارث نوح نبي الله السلام عليك يا وارث إبراهيم خليل الله السلام عليك يا وارث موسى كليم الله السلام عليك يا وارث عيسى روح الله السلام عليك يا وارث محمد حبيب الله السلام عليك يا وارث علي أمير المؤمنين. السلام عليك يا ابن محمد المصطفى. السلام عليك يا ابن علي المرتضى. السلام عليك يا ابن فاطمة الزهراء. السلام عليك يا ابن خديجة الكبرى. السلام عليك يا ثار الله وابن ثاره والوتر الموتور. أشهد أنك قد أقمت الصلاة وآتيت الزكاة وأمرت بالمعروف ونهيت عن المنكر وأطعت الله ورسوله حتى أتاك اليقين. فلعن الله أمة قتلتك، ولعن الله أمة ظلمتك، ولعن الله أمة سمعت بذلك فرضيت به. يا مولاي يا أبا عبد الله، أشهد أنك كنت نورا في الأصلاب الشامخة والأرحام المطهرة، لم تنجسك الجاهلية بأنجاسها، ولم تلبسك من مدلهمات ثيابها. وأشهد أنك من دعائم الدين وأركان المؤمنين. وأشهد أنك الإمام البر التقي الرضي الزكي الهادي المهدي. وأشهد أن الأئمة من ولدك كلمة التقوى وأعلام الهدى والعروة الوثقى والحجة على أهل الدنيا. وأشهد الله وملائكته وأنبياءه ورسله أني بكم مؤمن وبإيابكم موقن بشرائع ديني وخواتيم عملي، وقلبي لقلبكم سلم وأمري لأمركم متبع. صلوات الله عليكم وعلى أرواحكم وعلى أجسادكم وعلى أجسامكم وعلى شاهدكم وعلى غائبكم وعلى ظاهركم وعلى باطنكم. السلام عليك زيارة علي بن الحسين عليه الصلاة والسلام. السلام عليك يا ابن رسول الله. السلام عليك يا ابن نبي الله. السلام عليك يا ابن أمير المؤمنين. السلام عليك يا ابن الحسين الشهيد. السلام عليك أيها الشهيد وابن الشهيد. السلام عليك أيها المظلوم وابن المظلوم. لعن الله أمة قتلتك، ولعن الله أمة ظلمتك، ولعن الله أمة سمعت بذلك فرضيت به. زيارة الشهداء. السلام عليكم يا أولياء الله وأحباءه. السلام عليكم يا أصفياء الله وأوداءه. السلام عليكم يا أنصار دين الله. السلام عليكم يا أنصار رسول الله. السلام عليكم يا أنصار أمير المؤمنين. السلام عليكم يا أنصار فاطمة سيدة نساء العالمين. السلام عليكم يا أنصار أبي محمد الحسن بن علي الولي الناصح. السلام عليكم يا أنصار أبي عبد الله. بأبي أنتم وأمي طبتم وطابت الأرض التي فيها دفنتم وفزتم فوزا عظيما. فيا ليتني كنت معكم فأفوز معكم. زيارة أبي الفضل العباس عليه السلام. السلام عليك يا أبا الفضل العباس ابن أمير المؤمنين. السلام عليك يا ابن سيد الوصيين. السلام عليك يا ابن أول القوم إسلاما وأقدمهم إيمانا وأقومهم بدين الله وأحوطهم على الإسلام. أشهد لقد نصحت لله ولرسوله ولأخيك فنعم الأخ المواسي. فلعن الله أمة قتلتك، ولعن الله أمة ظلمتك، ولعن الله أمة استحلت منك المحارم وانتهكت حرمة الإسلام. فنعم الصابر المجاهد المحامي الناصر، والأخ الدافع عن أخيه، المجيب إلى طاعة ربه، الراغب فيما زهد فيه غيره من الثواب الجزيل والثناء الجميل. وألحقك الله بدرجة آبائك في جنات النعيم. اللهم إني تعرضت لزيارة أوليائك رغبة في ثوابك ورجاء لمغفرتك وجزيل إحسانك، فأسألك أن تصلي على محمد وآله الطاهرين، وأن تجعل رزقي بهم دارا وعيشي بهم قارا وزيارتي بهم مقبولة وحياتي بهم طيبة، وأدرجني إدراج المكرمين، واجعلني ممن ينقلب من زيارة مشاهد أحبائك مفلحا منجحا قد استوجب غفران الذنوب وستر العيوب وكشف الكروب، إنك أهل التقوى وأهل المغفرة. والسلام عليكم ورحمة الله وبركاته. السلام على أئمة المسلمين: علي بن الحسين زين العابدين، ومحمد بن علي باقر علم النبيين، وجعفر بن محمد الصادق، وموسى بن جعفر الكاظم، وعلي بن موسى الرضا، ومحمد بن علي الجواد، وعلي بن محمد الهادي، والحسن بن علي العسكري، ورحمة الله وبركاته. السلام عليك يا حجة الله يا ابن الحسن، يا صاحب العصر والزمان. السلام عليك يا خليفة الرحمن. السلام عليك يا شريك القرآن. السلام عليك يا كعبة الإيمان. السلام عليك يا إمام الإنس والجان، ورحمة الله وبركاته. صلوات. اللهم صل على محمد وآل محمد وعجل.
For Muhammadin wa ali Muhammad salawat. So I would like to invite the sisters, if they're comfortable, to come to the men's side. We have a partition installed, and inshallah there'll be a mic. There's a mic on the men's side here, and on the sister side, there's the lapel, the handheld mic, or the clip mic, sorry, that you can use if there's any question. Salawat.
بر محمد وآل محمد صلوات. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف الأنبياء والمرسلين، شفيع المذنبين وخاتم النبيين، نبينا وشفينا وحبيب قلوبنا وطبيب نفوسنا أبي القاسم المصطفى محمد. وعلى أهل بيته الطيبين الطاهرين المعصومين المنتجبين. أما بعد. Dear brothers and sisters, Salamun alaykum jami'an wa rahmatullahi wa barakatuh. We want to discuss a very important topic today. We'll just get a moment, Hassan, to finish setting up. Okay. We want to discuss a very important topic today, and this topic is around mental health. And the number one mental health illness in our society is the illness of depression. Depression and anxiety are both illnesses that kind of coexist together. And so it's a very important discussion, because as a community, it is important as a community that we are cognizant of the fact that, obviously, we are grounded in our spirituality and religiosity as a community. But as a community, we are also important, it is important that we also make sure that as a community, we also address the needs of the community in different facets of life, including their health and well-being, their mental health, their financial health, their economic health, their social health, social welfare health. This is all part of being a community. So today we are going to talk about the importance of the mental health dimension of our community, and a particular discussion around depression and anxiety. Now, as I said, depression is the most common illness in society, the most common mental health illness in society. And it is certainly one of the most common illnesses, mental health illnesses in our communities and in our communities worldwide. It's important to understand that when we talk about depression, we're not talking about grief that we all go through. So in our life, we have ups and downs, right? In our life. We have some good times, we have some challenging times, we have some sad moments in our life, and we have some happy moments in our life. That up and down in the life, that's normal, right? God forbid, if you lose a loved one in your family, if you lose a spouse or a child even, or a parent, you will go through grief. And that grief is not the depression that I'm talking about. That is a normal reaction. That grief reaction is a normal reaction. And Islam is actually quite beautiful, in the sense that this whole concept of, 40 days, right? Where we commemorate the 40th of our loved one, right? We call it Jalismu of our loved one, or the Arba'in of our loved one. Actually, that whole 40th is also very much grounded in the mental health research and the mental health kind of thinking around that being kind of the time. About 40 days is thought to be sort of the time when somebody who has had a loss in their family, a loved one, that is kind of the grief period. Even medically, we would expect somebody to go through around a 40-day period. And after that, you would expect the person to pick up their pieces, move on in their life, not so that they forget that they've lost somebody, but they are moving on with their life. And there are going to be times when they will be sad, they will remember their loved ones, and there will be times when they will move on with their lives, right? And so that 40 days is actually very much part of the research in the mental health field when you look at how important is it for people to go through that whole time. Now, what is important in all of this to understand is that the depression that we are talking about is actually a real biochemical illness. It is a medical illness. So we're not talking about this up and down that we have on a daily basis, right, in our lives. We're talking about an illness now that is really like diabetes. So as an example, or high blood pressure, hypertension, right? So this is an illness that actually has, is a result of some biochemical changes in your brain. Just like diabetes is, for example, a lack of insulin in your body that gives you, diabetes and your problems with, breaking down sugar. In a similar way, this illness is as a result of some changes, of biochemical changes in the brain that manifest itself in this particular illness, right? So we're talking about a very true biological illness called depression, right? Not the regular up and down or grief. This is a true biochemical illness. Now, this illness itself, the prevalence of this illness is about 11% in our population. There are certain populations that have a higher incidences of depression. Certainly the South Asian population is one of those populations that has a higher incidence of depression. But the lifetime prevalence of depression is about 11%. So at any one time, 11% of our community will be suffering from a major depression, right? The other thing that you have to understand is depression can affect different populations, right? It is, number one, more common in women than it is in men, right? It is more common in the teenage or the adolescent population, the population of the age of around 15 to 24. It is much more common in that population. And it is very common also in the elderly population, in the geriatric population, right? In the elderly population. And these are kind of the populations that are most affected. The one area that I think it is very under-recognized that this illness comes, and especially it's in the women population. And especially when women are going through some very critical times in their life cycle where this particular illness becomes very much more prevalent. So the first one is where we do not recognize it very well is in postpartum women. So women who have just delivered a baby and they get what's called postpartum depression. Now that postpartum depression in women can happen up to 1 year after they deliver a baby. The guru actually of postpartum depression in North America is a friend of mine who works at the Women's Center. Her name is Dr. Shaila Misri. She's the guru of depression in women, and especially in postpartum depression. So the women who have delivered a baby, the first year of the delivery of the baby is a critical time for them, you know, where they may suffer from a depression. The other time, and part of that theory, the theory around this is because of the extreme hormonal changes that a woman goes through when they are postpartum. The other time when it is very prevalent is in a slightly older population in women, which is in postmenopausal women. So postmenopausal depression is another very high-risk group of women who suffer from postmenopausal depression after they have menopause, because the theory again is that it's related to probably some critical changes in hormonal. Now, there is premenstrual depression and so on and so forth. There are eating disorders that go with it. We're not going to get into a lot of details of that. That's for another time, maybe, if you want to hear about it, because I've worked a lot in that area as well. Now, I wanted to just, pause here and find out. So there is a Menti thing that we're using, and I wanted to find out if any of you, if you can take your phones out and go to, is it menti.com? Menti.com, and put that code on top there, 19496201, and answer some of these questions, right? So, are you depressed, or do you know of anyone that is depressed? Again, I'm not talking about the regular ups and downs. I'm talking about somebody who actually suffers from depression. So it's quite interesting, right? So you've got at least 9 people, who have answered, who are not depressed, but they certainly know of others who are depressed. A couple of people, they say no. A couple who are not depressed. And there's about 5 people who are depressed and also know of others who are depressed. So you can even see from this very small, not everybody obviously has answered. If you can answer, that would be even good. But you can see even from this very small group that you either have depression or have suffered from depression, or you appear to actually know somebody who has suffered from depression. The problem with depression is that unlike diabetes, depression is not easily recognizable in some of these populations. So the question then comes as to how does depression present, right? What are the symptoms of depression? And how do I know that, either I'm depressed or somebody in my family is depressed, or my parents or my spouse or my children, especially if they're teenagers? How do I know? What are the symptoms? What do I have to look out for? Now, depression comes in different forms, in the sense that, not everybody who has a depression is going to present in the same way, right? And that's why it is so challenging, right? When you have somebody, who has high blood pressure, for example, hypertension, if your doctor measures your blood pressure, or if you have a self-monitoring blood pressure at home, or you go to one of the pharmacies and there is a machine there, the blood pressure is high, it gives you a reading, you have high blood pressure, right? If you have diabetes and, you get feelings of, tiredness, fatigue, and, excessive thirst, excessive urination, then you know that you may have diabetes, right? Unfortunately for depression, the symptoms are sometimes quite vague. And we are easy to brush off these symptoms because they're not so clear. And we don't have any test. We don't have a sugar test like we have for diabetes. We don't have a blood test to detect depression. We just don't have any tests like that. So most of the time, you go based on symptoms. Now, the symptoms of depression, obviously the most common one that people talk about is this persistent feeling of sadness, right? And what is almost known as an empty mood, right? This feeling of hopelessness, right, and sadness that somebody has. If especially in some of the older folks, sometimes what happens is they break down crying. And when you ask them, why are you crying, they won't be able to explain to you why they're crying, right? And then if you even ask them, are you depressed? And they'll say to you, no, I'm not depressed, right? It presents very differently in people, but there is this emptiness in your hearts. You feel really empty, you feel really sad. That's one of the symptoms. Now, like I said, not everybody has the same symptoms, but that's one of the symptoms. The other most important symptom that people don't take a lot of notice on is a condition called anhedonia. Now, anhedonia is, I have to use some words to make you think that I'm smart. Otherwise, you'll think I'm really stupid, right? So I have to try and show off a little bit to use some words that make you think that, okay, this guy knows what he's talking about. So anhedonia is basically loss of interest. Loss of interest is, a very, very important symptom. So if you have somebody in the community who has traditionally, comes to programs, attends social gatherings, does activities, goes out with family to eat, or socialize, and all of a sudden now they start to have no interest. And with respect to my Arab-speaking members of the community in Gujarati, I see a lot of older people who will say, "Mane nathi kaptu, mane nathi karu, mane nathi jaun." Everything is negative. I don't want to do it. I don't want to go. I don't feel like it. I don't want to go anywhere. I just want to stay home. I just want to stay in front of the TV or in front of my iPad or whatever it is. I just want to be at home. I don't feel like doing anything. And so this loss of interest is a very important component of potentially depression. In, of course, young couples, where a spouse may be suffering from depression, it may be that they have a loss of interest in intimacy with their spouse, right? That loss of interest is a red flag that there is something going. Loss of interest, or this thing called anhedonia, is one of the critical kind of hallmarks of depression. And then you have changes in appetite and changes in weight. So they just don't feel like eating. They don't want to eat, right? They don't want to eat because they don't enjoy eating. They sometimes will force themselves to eat because they know they have to eat, but they don't enjoy eating. And so what you end up getting is very significant weight loss in these people. And inshallah, if we have the right conditions, next week we are trying to plan a session on weight loss and Ozempic and all of that stuff, which will be very interesting, right? But this unexplained weight loss, right, is very important. And sometimes even, the patient may not realize that he or she is losing weight. But if you see that all of a sudden the clothes that they're wearing are too loose, their pants have become too loose, their clothes have become too loose, they're starting to lose weight. This weight loss is a very important component of depression. The other one that you see is sleep disturbance, right? Now, sleep disturbance, classically in depression, you get what's called early morning awakening. Now, what's early morning awakening is the person goes to sleep, let's say at, 10 or 11, whatever time you go to sleep. Normally, they would wake up at 7, right? But they wake up at 3 in the morning, wide awake, and just they don't know what to do with themselves. They have no idea what to do with themselves. They're wide awake, in bed, they don't know what to do, right? Now, I'm not talking about those people in the community who deliberately wake up early in the morning to recite their Salatul Layl. Please don't think that that is depression, okay? But I'm talking about those people who normally wake up, at 6 or 7 o'clock or whatever it is, and then, and then they start waking up early morning awakening. In some people, it's insomnia. They just can't go to sleep. So sleep difficulties is very, very important. The other one is fatigue and loss of energy. They're just really tired, right? They don't want to do anything. They're so fatigued and tired. They just, every day, they don't want to do anything, right? For, a lot of the women and men for that matter, when they have loss of interest and fatigue, they end up just staying in bed most of the time, right? So this loss of energy, and when you ask them, for no reason, they just feel tired. I'm just exhausted. I'm tired all day, right? The other symptom you get is this feeling of worthlessness, absolute hopelessness and worthlessness. There is no meaning in life anymore. Feel absolutely worthless, right? And they have excessive guilt. They get into excessive guilt. And sometimes, communities can make it worse, right? As a community, sometimes we are so good at judging people, right, that you make people feel guilty, about themselves, right? And a person who's suffering from depression, the last thing you want to do is to feed them into that guilt that they have, right? A person may feel guilty about their parents. Parents may feel guilty about how they've raised their children. So many different things happening, right? There are some other symptoms around difficulty concentrating or making decisions and things like that. And then of course, the most serious symptom of depression is this, the symptom of suicide, wanting to end their lives. Now you may say, that's not happening in our community. That doesn't happen in our community. Trust me, it happens in our community. And I have personally been involved in our community where there are people in our community who have tried to attempt to take their lives because they have been severely depressed. And the worst thing you can do, honestly, is to judge them, right? And we are so good at judging these people. And respectfully, I say that even our ulama sometimes are very good at judging people. How could you take your life, right? How could you possibly take your life, right? And we don't understand that this is a symptom of an underlying biochemical illness. I had one person in our community who is still in our community, and inshallah you don't know who this person is, who went and actually hung himself in his house. And his wife was the one who saved him. Right? And this is in our community. And this man was a pious man. Used to wake up for salat in the morning, read his salat al-layl, fasted, Quran, everything. The symptom of wanting to take your life, if you have depression, is so powerful, sometimes they just can't control it. And it can happen. Right? So it's important to not judge people when they're going through this serious mental illness in their lives. Right? Some of us who are suffering from depression, there are two types of suicide. There is active suicide and there is what's called passive suicide, right? So a young person may be driven to commit suicide actively, jump off a bridge, hang himself, or something like that, right? For an older person, they have a lot of the times what's called passive suicide, right? So what they do is they stop eating and drinking because they think life's not worth it. Or they stop taking their medications because they think life is not worth it. So they have passive suicide, right? They stop eating and drinking, they stop taking their medications because they think it's not worth it. Now, sometimes, and I say this with respect to our elderly who are sitting, in the audience, and I see this a lot in my practice, and especially in my practice where I see a lot of South Asian members of the community. A lot of the times they'll say, you know what, life is not living. Life is not worth living. I just wish God took me away. I'm done. I wish just God ended it. I don't want to live anymore, right? And so when you have people who are saying this kind of things where they haven't said this type of things before, it really should raise, some sort of a flag in you. So I want to make this interactive. I don't want it to be a lecture. So I want to go to a question that I have on Menti. From what I said, what do you think? Is depression a medical illness or is it just a psychological state? It's really important to be very clear about what we're talking about. What do you think? Right? You can use your Menti to answer this question. I hope, well, it looks like the answers are going in the right direction, right? I hope you got the message. We're talking about a medical illness, right? That's really good. I want to go to the next question if I can. Now, do you think prayers and dua are enough to cure depression? What do you think? Are prayers and dua enough to cure a depression? Interesting. You see, I'll tell you something. You know what? My term as president is over in a month or two, so I can be free and talk openly as much as I can. A few years ago, my children visited a question and answer session with a speaker that came to our community from outside. And the speaker, and then we were having this discussion at home after they attended the question and answer session, because a lot of the times these question and answer sessions are for youth and other people cannot attend. And I wasn't in the presence there. But I was really struck when we were discussing this at home, where the speaker said that depression is a sign that you are away from God, that you are disconnected from God. And, you know, the reason that he gave, he says, because the evidence for this is that our imams were not depressed. And the reason our imams were not depressed is because they were so connected to God. So if you have depression, you can pray to Allah that He gets you close to Him and that you can find happiness. And when I heard this, it really disturbed me that this is what was being told. Because honestly, this is not the right answer. You cannot pray yourself out of depression. Just can't. It's a medical illness, just as you cannot pray yourself out of diabetes or high blood pressure or cancer. Does prayers and spirituality have a role? 100% it has a role. 100% in the treatment of depression, it has a role. But you cannot say that you are depressed, and the reason you are depressed is because you're disconnected with God. Because I got to tell you, I know the most pious, connected people with God who have suffered from major depression. So this notion that we have that we can, pray ourselves out of depression, is problematic for me, especially when you're talking about a, biochemical illness. I want to emphasize spirituality, du'as, prayers, all of those have an absolutely critical role in the management of depression. No doubt about that. But it needs a lot more than that if you're suffering from a biochemical illness. So it isn't just enough. There has to be other things. And sometimes, sometimes we, haven't understood, I should say, the various dimensions of Tawheed that we have. Because one of the dimensions of Tawheed is Tawheed al-Af'al, right? Which is, Tawheed al-Af'al is that, Tawheed, the oneness of Allah subhanahu wa ta'ala, which looks at the oneness of Allah of actions, right? So when you are suffering from an illness, you will see from hadith, it's absolutely rampant in our hadith. It's not that the imams even didn't say that I don't want to see a doctor. Right? So if you're suffering from an illness, Islam wants you to seek help, to seek, expertise in medicine, as an example. But Islam wants you to understand the Tawheed al-Af'al, which means that when you go and see a physician, that physician, when he gives you a medication, that medication, the effect of that medication is from Allah subhanahu wa ta'ala. The ultimate healer is Allah. Right? He is the ultimate healer. But nowhere in Islam does it say that you should not seek any treatment from an expert. You just can sit at home and do dua. You have to put in your effort and then have that confidence of tawheed, in action, where you say to Allah that I am doing my part. Now I want you to put the effect of the healing in this medication that I'm taking, that the physician has given me or the expert has given me. It's very important to understand this point. Rather than saying, you see, you've never have anybody say that, why don't you pray yourself out of diabetes or high blood pressure, right? Only when it comes to mental illness, we start to make, judgments on people to say, no, this is because you're not connected to God. And this is not right, in my opinion. So I think that, it's a very important part to understand. Now, I want to just give you an opportunity to hear a little bit of any comments that you may have or questions that you have. And I can certainly talk a little bit about treatment of depression. The good news about depression is that 80% of depressions are treatable. Now, I'll tell you, we are a community, right? So we always focus on the 20%. Yeah, doctor, what about the 20%? No, there are not many illnesses in medicine where you can actually say 80% is treatable. So 80% is a huge number. So depression is essentially a very treatable illness. Very treatable illness. If you get the right help, if you get the right intervention, combined with spirituality, combined with your religiousness, your du'as, your tawakkul on Allah, having that understanding of that tawheed of action, where you are saying, Allah, I am doing my part, now you make the healing for me, because you are the ultimate healer. That then becomes a really good recipe for you to actually have this illness managed. Because depression has a huge effect on the social, emotional, psychological, and even the physical well-being of the individual. And it doesn't just affect them, it affects the entire family. And I've seen entire families being destroyed because somebody has been suffering from depression and the family and the person is in denial. And they feel, well, if I am depressed and I'm getting treatment from this mental illness, it comes with a stigma. And people, what will people say, right? What will people say? And the people will judge me. They'll think, who gando tegyo chon, who I've lost my mind, and and all of these things, will come into place. And what will that do to me? So, Muhammad Hassan, I'm going to stop there, whilst people can have some tea, and I think there's some nice pastries there. So we can have some tea and pastries on the men's side and women's side. And as you're having tea, we can have a conversation if you want to ask any questions, have any reflections. and then we can talk a little bit about treatment, and then we'll finish. So whilst the volunteers are serving tea and tabarruk, do you have any questions or any comments that you would like to say? There is a mic on the ladies' side. I think there is a lady in the back there who wants to say something, and there is a mic in the gents' side.
Assalamu alaikum.
Alaikum salam.
Sorry, just wondering about the treatment. So, firstly, is that without improving the situation? Like, for example, somebody has lost his job and had become depressed, and then he will be cured without finding a job with medicine. Is that true?
Sorry, if somebody loses a
Yeah.
job, and then what happens?
I mean, without improving the situation which had caused the depression, is the depression,
So,
yes.
so you have to be very clear as to what you're talking about, right? So when somebody loses their job, for example, they're gonna become sad.
Right.
And they're gonna have they're gonna feel sad, they're gonna feel upset, they're gonna feel frustrated, right? That isn't necessarily depression, right? That's a normal reaction to a situation, right? Now, sometimes what happens is that if that person, like, one of the things about depression is there is a genetic tendency to depression. So it runs in families, right? And so let's say that person is genetically predisposed to depression.
Right.
And sometimes an emotional, social, psychological stressor will bring out an already existing depression in that person.
Right.
So that person may lose their job, and because they're already predisposed to this biochemical illness, it may bring that out. Just by giving them a job is not going to reverse it, if it's a clinical depression. If it's just they're being sad because they have lost their job, then
Right.
yeah, if they get another job, they'll be happy again,
Okay.
right? Just as you become sad, for example, not you, but just as a person becomes sad, for example, when they get divorced,
Right.
right? They go through a sadness, but then if they marry again, they become happy again, right?
Right.
So that's not depression. This depression has very clear symptoms associated.
Okay. And how long does it take to treat depression, usually?
How long does it take to
Treat
depression? Yeah, it's a very good question. So once the depression is recognized, and we can start talking about treatment, once depression is recognized, there are different modalities of treatment. So one of the treatment modalities, thank you, Mawasa. One of the treatment of modalities is psychotherapy. It's called cognitive behavior therapy. Actually, if you look at cognitive behavior therapy, its origins are very much ingrained in the mazhab of the Ahlul Bayt. If you look at the principles of cognitive behavior therapy, which is what our Aimma used to do with a lot of people, in society. But that is one mode of therapy. The other one, of course, if you have the symptoms and the symptoms are quite severe, then you're going to need medications. And there are different medications. And the trouble with these medications is because they affect the brain, they take time to work because they change the brain chemistry. And you cannot change brain chemistry overnight. So it takes at least 6 to 8 weeks of these medications in order to regulate your brain chemistry. Now, within those 6 to 8 weeks, you should start to see some improvement. So your sleep will improve. Your energy may come back. You may start to want to eat again, right? You will have a better appetite. You will lose less weight, right? But you still may have some symptoms of emptiness and worthlessness, and that may not go away in the first 2 weeks, 3 weeks. It's important to stick to the medications for the duration of the time that your doctor prescribes it for you in order for you to have a full effect of that medication. Okay. Any questions from here, men? So there's a question in the back, Amir bhai.
Does a person who is depressed become, who is depressed will become overweight because
Yes.
of so much eating?
Mm-hmm.
Thank you.
So, one of the, thank you for asking that question, Amir bhai, because you're absolutely right. So, I mentioned weight loss as a symptom of depression. Weight loss is more common as a symptom of depression, but weight gain is also an important symptom of depression. So somebody who just gains weight for no reason, that could be a potential symptom of the underlying depression. Yes, that is correct.
Assalamu alaikum.
Alaikum salam.
I wanted to ask, you mentioned, I think is important contributor to why people don't receive help. And I think part of that is because people feel like they're the only one, because we live in a world where everyone is posting in, the best version of themselves. And it's quite a struggle, because I think we've deceived ourselves into thinking that everyone is happy and that everyone has a perfect life, and that's just not the reality. Even we look at the Mentimeter and we see that, it's not there anymore, but, a good, 90% of people know or do experience, feelings of depression. So how do we combat that feeling of, that stigma, particularly for those who are more vulnerable, and, give them a sense of, making them feel surrounded?
I think that is such a wonderful question that you have asked. I think it's really difficult, but I have 2 or 3 recommendations. One is, I think, education. I think we need to talk about it openly, right? As a community, I think we need to talk about it, right? I think we need to make sure people understand that, you can't be labeling people when they're suffering from some critical, mental health issues. And we're the best at labeling. Gotta tell you, we're really good at it, right? We wanted a degree in labeling is number 1. We're really good at labeling, right? So raising awareness, understanding what the reality of these issues are, is very important, that we start to talk about it. So that's the first thing. But the other thing is, depression itself affects communities in many ways, in many different ways, right? And sometimes, depression can lead to some serious consequences, especially in the younger population, and especially in younger female population. It can lead to some very significant eating disorders, right? So the whole area of body image and trying to, present a different body image can lead to a lot of eating disorders amongst especially the women, but it can happen with men as well. And sometimes, our shaming people because of their body image is something that contributes towards that person becoming, even more depressed and feeling that way. But I think that what we need to do as a community, honestly, is we need to develop a system where we are able to reach out to people in a way that's non-judgmental, where we can reach out to them, make an effort to find out how things are. Why is somebody not attending? Why is somebody not socializing? Why is somebody not engaging? Why, what is happening? And in a non-judgmental way, as a community, I think it is important. It's not the role, it's not the role of one person in the community or two people in the community. I think it's a system that you need to develop. And the system that you need to develop, where you are connecting with people as a community where you are, concerned about their welfare. We don't have a community system like that. We have a system of community where we want to just gossip about people, we want to just talk about people, and this person's like this and this person's like this. But we don't have that sense of a caring community that truly wants to address the underlying, serious mental health issues that that person has to go through. So I think there are things that you can do within your family. I think there are things that you can do, also within a community, But I feel that raising awareness, education, letting people know that this is a medical illness and there is nothing wrong in you suffering from such an illness because it's a biochemical illness, but the good news being that there is treatment for it and you can be, managed appropriately with, for this illness. I think that's the kind of approach we should have as a community.
Thank you very much. Yeah.
Yeah, we have a question.
Yeah.
Sorry, Salam. I think you did a lovely job of talking about how there isn't agency, I guess, associated with suicide, it is a mental health condition, but we were just kind of discussing about the sin aspect of it, that we're kind of taught that it's something that you shouldn't do because there's a sin associated. So I was just curious if there are any ahadith about that, if the Ahlul Bayt address that aspect at all.
Yeah. Lots. There's lots of information about suicide. If you look at the hadith around suicide, where a person decides to take their life, when there is no, where they have, suffering, and they don't want the suffering, and they just want to end their suffering, right? That's a very separate issue compared to a person taking their life because they are actually suffering from an illness which they can't control, right? So I'll give you an example, right? I go to a nursing home because I specialize in geriatrics. I go to a nursing home, and I have this patient, and this is a real example. I have this patient who has pneumonia, and the patient's non-stop coughing, right? And the nurse gets really upset at the patient because he's just non-stop coughing. And he's saying to that patient, can you just stop coughing? Right? So I went to this nurse very respectfully and said, you can't do this. This is not in his control, right? He's coughing because he's got pneumonia, right? He's got a cough because he's got a pneumonia. By telling him, you just got to stop doing this, it's not going to work. So when you look at even the hadiths from an Islamic perspective, when you have a mental illness and somebody is carrying out an act that you may say is haram, it isn't when that person is doing that as a result of their mental illness. That is not what is haram. This is a state where they are unable to control that symptom, that underlying symptom that they have. And that's the problem that I have. So, oh, you tried to kill yourself because you're not connected with God. It's not like that. It's very different, right? I can understand somebody who may, whose wife or husband may have left him, and he or she loves her so much, and now he just thinks life is not worth living, and they just. But I gotta tell you, the human being has such a strong and powerful will to stay alive. Like, it's not normal for a person to want to kill themselves, because that powerful will of wanting to preserve your life is, there's studies done in this, right? There's studies done in people who have terminal cancer, right? Who are not depressed. When you ask them, do you want to just end your life? They'll say, no, I still want to live, right? I've got 95-year-olds who think that they're 20-year-olds because they still want to do stuff in their life, and I think that's beautiful, right? So, I think when you talk about suicide as haram, I interpret that as a state where somebody wants to end their life, completely, without reason, where there is nothing else that's motivating them to do this, right? So for me, it's a very difficult thing to justify, as far as suicide is concerned. I can understand suicide when somebody does it, when somebody takes their life for no apparent reason, but I gotta tell you one thing, man, that is rare. Like, honestly, I have not seen that very commonly. For somebody wanting to take, because they have, they have no other way, right? Unless they are really clinically depressed. And when you're clinically depressed, honestly, and sometimes that thought comes in a very impulsive way. It could be with you, an hour later you will hear, oh, he tried to kill himself. And you'd say, well, I was just with him. It was okay. He was not talking about it. The other thing about suicide that people have, that's a myth, and that is, they say that if I ask somebody if they want to kill themselves, then maybe I'm putting their thought in their head that they will kill themselves. That's a myth. If you feel somebody is depressed, you should ask them, do you feel like you want to kill yourself? Yeah. Can you just use the mic, Fatim?
Thank you. I think this is kind of also very confusing sometimes when we give mental health and depression this element of understanding. And I think it's absolutely right that it's not within the control of an individual. The conversation then goes towards other situations like, say, addiction. And why don't we have the same sympathy or understanding when people are suffering from other scenarios that are equally not within their control? And is it true when you think about addiction in the same way that you speak of depression?
Yeah, Fatima, I think that really we ought to have a whole session on the addiction. I've done, when I went to recite lectures in Muharram, in a couple of communities, we had a half-a-day workshop on addictions with the youth, because I've dealt with this area quite extensively. But you are 100% correct, right? There is a level of addiction that is definitely a change in biochemical neurotransmitters in the brain, right? It's a very dopaminergic, forget about it. I don't want to use fancy words, but it's a very clear correlation between certain neurotransmitters in the brain and a person who gets addicted, right? And sometimes we have restricted addiction in our communities to what is kind of common mainstream. So addiction to drugs. Everybody worries about that in their kids, right? Addiction to drugs, whether it's, illicit drugs or whether it's, nicotine, whether it's marijuana, right? Trust me, there's a lot of people in our community that do pot. I can tell you that because I know, right? So we focus on that, right? That kind of drug addiction. But addiction is vast. It's more than that, right? There is, gaming disorders, for example, that are clear psychiatric disorders right now, which are, addictive gaming disorders, that come into that. There is pornography as an addiction, right? And right now, there is very easy access to pornography, right? And it's in the hands of 10-year-olds, right? And so that dopaminergic pleasure center is really, really fired up, There is addiction in our community around ghiba, around gossip. A person who will phone a friend to talk about other people cannot function in their day until they pick up that phone and tell them about other people. It's an addiction. It's an addiction of gossiping, right? Why? Because it gives them that dopaminergic kind of, pleasure, it stimulates that pleasure center, right? There is a religious addiction which is very healthy, right? And Allah has put that in you. And that addiction is for you to have unconditional love to God, right? And how do you enhance that or expose that in yourself, as an underlying addiction? So, addiction is a vast topic, right? But the principles of addiction are not different in many ways to what you are sort of talking about in depression, which is the fact that, it is a biochemical illness. Now, the problem with addiction is it's much harder to manage. It's much harder to treat than depression is. There's no addiction pill. Management of addiction is a process, right? And it's a process that takes a lot of effort. It takes a lot of work. It takes a lot of support systems. It takes a lot of understanding. But unless we do something about it, we have a lot of people in our community who suffer from different kinds of addictions. Yeah.
During that, my follow-up to that is depression preventable?
The biochemical depression is not preventable. It's manageable, but it's not preventable. The good news is that, number one, it's treatable. The other good news is that you may have a predisposition to depression, but it may never manifest in your lifetime. Because you have created an environment for yourself where, there aren't any environmental or psychological factors or stressors that may actually bring out that. It will theoretically eventually come out, but you may die before that happens, right? So is there anything that you can do to prevent depression? There is not a lot of studies done on that area, other than the fact that this is where religiosity comes, this is where spirituality comes, and there is studies that show that if you are predisposed to depression and you are, actually it's mostly from the Jewish community, by the way, or most of these studies have been done in the Jewish community, that if you actually have a psychosocial spiritual system which is very positive for you, then you can certainly prevent that depression from exposing itself for a number of years. Theoretically, the experts will say that sooner or later, it may still come out. Okay.
Assalamualaikum.
One more question here. Okay.
Assalamualaikum.
Alaikum salam.
First of all, thank you, Akber Uncle, for sharing your insights on this topic. And thank you to the organizers for talking on this prevalent topic. As you can see on the stats that we saw on Mentimeter, in this room of probably 50 people, how prevalent this issue is within our community. I also would like to thank everyone for being brave enough to even say that, you know what, I am experiencing this. I just had a quick question, as this is more on the community aspect of things, as you did mention how it's important for the community members to, you know, reach out to your fellow community members and things like that, to provide support and here and there. But as you're probably very familiar with the system of the mosque itself, I just wanted to ask for, especially the people who may be unfamiliar with the services provided within our mosque, what type of resources that may be available to them if they are in those stages, and how they may be able to access those steps as well.
Look, what I am about to say may be inflammatory, but like I said, you know, so what, right? Not the first time Akber Uncle has said something that may be inflammatory. I think we need expertise in the community. And I think that we cannot think that somebody is an expert in mental health counseling and mental health illness just because they are an expert in another field, right? I think we have some very well-meaning people in our community, but I do think that if you want to develop a system, you need to develop a system with some level of expertise in it. So I'll give you an example of, for example, Maulana Nasir Zaidi, right? Now, I know sometimes members of the community, may not have, heard of him very much. They don't know his expertise, but he's actually got a degree in counseling psychology, right? He's actually got a degree in counseling psychology from UBC, right? And he's a spiritual healthcare provider, right? Now, he may not be the right counselor. I'm not saying he should be your counselor. What I'm saying to you is you got to surround yourself with a level of expertise in the community. I think we have experts in this community. I think we have counselors in this community. I think we have psychologists in this community. And I think that, we have, counselors as well in this community. And I think that these people in our community actually want to give. They want to give back, right? And I just don't think we allow them to do that. And sometimes when we identify a Mr. X or Mrs. X or, something, immediately people will say, oh, what does she know? What does he know? Why should I go to him? Why should I go to that? I don't think we do a very good job of marketing this. I don't think we just throw a name. We say, oh, Akber Mithani is, if you have a mental health issue, call Akber Mithani. Oh, look at what the, Akber Mithani, like, what's he gonna do, right? But I think we sometimes don't explain to people that, look, we are asking you to call this person and this person because we actually think they have, the expertise to contribute, to help. And so I think we develop a system, but we need to identify experts in the system. And there is a lot of issues when it comes to mental health around privacy, the importance of keeping things confidential and things like that. I think it's really important that you do that. But I think we do have in-house expertise. Now, what I've done when I have been faced with issues from our community members, honestly, is I've accessed these people privately because I know, right? So I have, people, who are suffering. There's been, issues of domestic violence. There's been issue of PTSD. And I know people in our community amongst the women as well as amongst the men who are willing to help. And I have to tell you, whenever I have called a person in our community to say that, look, there is somebody who may require help, would you be willing to help? I've never had that person say no to me, that no, I don't want to help. They've always said, absolutely, I'll help, and I'll do it free of charge because I want to help the community. I think we need to develop a well thought out system. But unfortunately, we haven't done it. Honestly, we haven't done it. We've become so busy in things that are not important that we haven't done the important things. Yes, Hastali bhai.
Assalamu alaikum.
Alaikum salam.
But very much for the information you gave. Would like to out one you told now. We have that there is no names of because people know on themselves to offer their services or something. So that missing probably in the community because we just go on our life, lecture is over, we go home and forget about it, you see. So when we came a long time ago over here from back home, we didn't have lecture that one, see. Maybe it's we can help it out. That's my suggestion. Thank you.
Yeah, I think
lecture.
I think your suggestion, you were cutting off there, but I think your suggestion of having, experts in the community identified, right? I think that's what you're getting at, right?
Yeah.
Yeah, Mama said.
Exactly.
Yeah, I think it's a really important suggestion. But I also think that we need to do that on all facets of community life. Listen, guys, we're not just a religious organization. This is a community, right? It's not just coming to the mosque and doing salat and doing amal and listening to lectures. That's not what a community is. A community is where you have different needs. We have social needs, we have financial needs, we have health needs, we have mental health needs, we have well-being, we have addictions, we have all kinds of social welfare, all kinds of needs in our community. That's our job. As a leadership team, for example, we are looking at a community here, right? And that community has different facets to it, different dimensions to it. Grounded in our faith, in our mazhab, we will not do anything to compromise our faith and our Islamic values and principles. Of course, we will not. But just, Hasni Bhai, just as you want to have some people identified, for example, in the health field who can help from the community, we have professionals in the community, right? Who are very, very successful. We have these young kids who are in high school, who are going into university. We need to make sure we are supporting them to become the best doctors and engineers and lawyers and pharmacists and whatever, right? We have that resource. We should be helping them in their careers to get to the best level that they can, right? We have business people in our community, and we should be looking at financial health of our community, where we should be able to help people in our community to excel in their financial and economic health. This is all part. This is what Imam Ali alayhi salam did. Imam Ali alayhi salam didn't just stay in the mosque all day. He helped the fabric of the community when he was a leader. He helped everything, and he identified people within his own, government, within his own system, to help members of the community, right, in different aspects of their lives. Right? That's what we have to learn. This is about, I remember going to Agha in Najaf, and that was his message. His message was that, I am proud of the community, the Khoja, Ishnashri community from East Africa, from this. He was talking about World Federation. He said, I'm so impressed the fact that you are a community. And your governance is what has driven you. Don't lose that. That's a conversation with Agha himself. So I think you're right. I think we have to identify this. I gotta tell you, there is so many people here who may never ever want to be in an executive committee or a president or anything else, but there is a lot of people who want to help. We just don't ask them. I don't ask them. And so they go about their business. Right? Just do their thing, because nobody's asked them. We have far to go in building communities. Okay, then enough for today, right? 9:24, 9:25, I think. So enough for today. I think it's been, we ended up doing this for almost an hour and 20 minutes. So if we can end today, then maybe with a recitation of Surah Fatiha.
Yeah, if I can, sorry to cut you off, Bronco. I have a request for Surah Fatiha, so we can do that as well,
Yes,
please. For Marhum Ghulam Muhammad Wani and all Marhumeens in the family of Manzoor Ahmad Wani, please read Surah Fatiha for these Marhums and all the other Marhumeens. Al-Fatiha. And thank you very much for joining us. Just a quick reminder that tomorrow there is Dua Nudba at 6:30, inshallah, with Fajr Salat and breakfast. Then we also have Juma Salat. Bibi Fatima's Wafat is tomorrow, inshallah, at 7:30. And on Sunday there is also a program for Fajr Namaz here at Az-Zahraa at 6:30 a.m., followed by breakfast. And also we have Kabristan program at Heritage Garden Cemetery this Sunday at 11 a.m. Everyone is invited to join. Salawat.